What are some of the harassment issues that you are contacted by MIPS?
Sure, well I thought initially I'd just also say that we do actually get a couple of calls a week from clinicians who are aware of patients who are in a violent situation or a potentially violent situation, and they're often confused about their obligations. Obviously the majority of the calls, people are wanting to help the person in that situation, but the legalities are that obviously in most situations you can't do it without the patient's permission. So that's a common query that we get, and often obviously sometimes assisting people who are involved with subpoenas and court cases and that sort of thing. But look, the other thing that we get very commonly called about is harassment in the workplace, and harassment in the workplace obviously can be harassment from colleagues, harassment from other people in the workplace, and even harassment from patients from time to time. So giving advice, talking things through with people about what their options are is kind of an important part of our job. So that probably one of the commonest calls we get is sometimes people aren't actually sure whether they're being harassed. So they actually sometimes phone up and run a scenario past us and say, look, you know, is this something that I'm being oversensitive about? And sometimes people are being oversensitive, and it's important to tell them that. For instance, perhaps they've had some feedback about something and their performance wasn't quite the way they saw it. And actually getting to the bottom of whether something's a reasonable behaviour by a colleague is something we try and help people do. But look, in the main, obviously we're very keen for people to speak up if they feel they're being harassed, or in particular feel that someone else is being harassed, because that's a very common scenario too. We also obviously take calls from the people who are accused of doing this kind of behaviour, and that's obviously important to give people a fair hearing if they've been accused of things, and can talk about that maybe too if that's of interest.